Hello friends, good morning. I am Dr. Ankit Gupta. I am a plastic surgeon at Panache Aesthetics in New Delhi, India, and today I am going to make a video which will answer most of your queries of gynecomastia, which is also called as male boobs. This I have designed in a way like what a patient usually asks me, and it is kind of a virtual consultation. If you wish to have a consultation with me, these are the usual questions that you have, and you'll get a review of what I'm going to answer, and it will answer most of your queries. And let's start and not waste time, and I think this video will be sufficient to answer most of your queries. So the questions that patients usually ask: number one, do I have gynecomastia? So for that I need to examine you, and see, gynecomastia is nothing but development of male boobs, or that is the breasts in a male patient. So if you feel that there is extra deposition of fat or a gland on your chest, that means you have gynecomastia. So ideally gynecomastia is something if you have a gland beneath your nipple. So if you palpate or you just hold the nipple and press it, if you feel something sort of a gland or something, that means it is a true gynecomastia. If you do not feel anything, it is just fat, soft tissues, then it is fat, which is pseudo gynecomastia. Does it really matter? It does in the name, and also the surgery will differ depending on if you have a true gynecomastia or pseudo gynecomastia, but yes, both needs to be treated if you don't like it. Second, is it fat, is it gland, is it both? So you can get a rough estimate of is it a fat, gland, or both, depending on what is your body mass index or your BMI. How can you calculate? You can have your apps or something which will have your height in centimeters and your weight, and you can use that calculator to calculate your BMI. If your BMI is anything above 25, there is a high probability you have fat as well as gland. If your BMI is less, in that case the chances of having your this fat is less. If you have a much more BMI, the chances of having more fat is much more. If you palpate it, if you feel a hard structure, that means it is a gland. If you don't feel a hard structure, you don't have a gland. If you have those nipples which become erect, they are puffy nipples, you definitely have a gland. If you have taken steroids, if you have taken testosterone injections, steroid injections, supplements, you have taken some sort of injections to pump up your muscles, to build your muscles in gym and all those do have some chemicals which finally are converted into female hormones and which help the gland to grow, then you definitely have a gland. The final decision can only be made when I actually examine you, but you can get a rough estimate. Most of the patients do have a gland, even if they have only fat, because the fat converts the hormones in our body into the female type of hormone which help in the gland being made, and so you develop some gland or something. Then the patient usually asks me, is it what grade it is, grade 1, 2, 3 or 4, or grade 1, 2A, 2B, 3. So grade 1 is nothing if just a gland which is a very small gland. Grade 2A is a gland with fat, but the skin is not saggy, but it is bigger than grade 1. Grade 2B is when the size is almost like grade 2A, but this gland is saggy or the breast is saggy. Grade 3 is when there is a lot of skin excess, the breasts are huge, and some people make it as a grade 4 also. So it's either 1, 2, 3, 4 or 1, 2A, 2B and 3, depending on which classification you follow. Does it matter which grade it is? For me, if it is grade 1 or 2A, then you are in one category. If it is grade 2B, 3, you are in second category. And for the ones who have a huge amount of skin extra, it is the third category. So grade 1 and 2A who have a small gland or a gland with some amount of fat, it is not saggy, I would like to operate them with liposuction and gland removal. There is no need for any skin removal, and they get a very good results at a very early stage. There is no extra skin in those, so they have a flat chest even on the table, and the second day when we remove your dressings, you see a almost normal chest. For those who are grade 2B or grade 3, they have extra skin, so it takes time for your skin to contract back to get into shape. if you don't have too much of extra skin. So like in a pregnant woman, the tummy gets bigger when there's a baby inside, but when the delivery happens, usually the tummy goes back inside, but can never go 100% inside. So depending on how much extra skin you have, 80 to 90% of the patients, they do recover very good, and there is no extra skin in them as well. The grade 4 ones, which I'm telling you, is the extreme levels, who have extreme excess amount of skin, who have lost a lot of weight, say 50 kgs of the weight, they have lost it. They have extreme amount of skin in which the breast is hanging till your tummy. In those cases, you cannot expect that amount of skin to contract back. So for them, there's a different surgery, which I won't be discussing here. It's a totally different spectrum. Really hardly 1% of the patients fall into that. 99% of the patients do not need removal of the skin. So that is the importance of grade, and how you can assess the grades. You can view some pictures of grade 1, 2, 3, 4, and you can compare it, but it really hardly matters. The other thing that matters is grade 1 and 2A can be operated under local anesthesia. Recovery is much easier, faster. Grade 2B and 3 usually requires a general anesthesia, which is a bit more prolonged. You'll have to stay here with us for 6 hours at least. Second questions people have is, sir, is it cancer, or can it develop into cancer? Usually when the patients come with their parents, the parents have these issues. Can it develop into cancer? Should we get it operated as soon as possible? Our child is only 14 years as of now. So to answer that, no, it does not develop into a cancer. Only if you have Klinefelter syndrome, which is rare disease, which you might be knowing if you have it. In those cases, there is a probability. Otherwise, the chances of a male developing cancer is equivalent if he has gynecomastia or if he does not have gynecomastia. So do not fear gynecomastia, that it will develop into cancer. So why do you need to get it operated? So you get it operated only if you don't feel comfortable, if you are psychologically affected by it, if you have tried gym, exercise, everything, you have tried weight reduction and the fat is not going anywhere. You can palpate the hard nodule, the hard mass. That won't go with exercise and all. No female can reduce their breast with exercise. So how can a male remove their breast with an exercise? It is nothing but male boobs or gynecomastia. So if you have a hard gland, you need a surgery. If you don't feel comfortable wearing tight t-shirts, you don't feel comfortable removing your shirts in front of your friends, going to beaches and all, then you can get operated. So it is mostly a cosmetic procedure, and that is why it is not covered in most of the insurances and your government panels, and you have to get it without any insurance. Insurance usually does not cover it, in short. So I have answered why you should get it removed. If only and only if you are concerned and you want to have a much leaner, fitter, flat chest and a more muscular looking chest. You do not want those bulges, you do not like them, and you don't like it in your t-shirts, and that's it. Will it come back after the surgery? See, if I remove the gland will not come back, because I have permanently removed the gland. For example, say if I remove a breast of a female, they cannot regrow a breast, right? So the same happens. The surgery is removal of the breast tissue that is inside a male. So if I have removed the gland once, it will not grow back. The fat, if it was only fat, if you keep on increasing your weight, if you gain say 20 kgs, 25 kgs, some fat will definitely get deposited, but more fat will get deposited elsewhere in the body. So I do recommend my patients to have a healthy lifestyle even after the surgery. So that is, will it grow back or not? Many patients who are into supplements and all, they do ask me, sir, I am planning to take supplements even after the surgery, so it should not grow back. So ideally it should not grow back, because once you have removed the gland per se, the gland cannot grow back. Okay. Then why did I get it? What is the cause of this? So there are two set of patients that I usually see in my OPD. Rather, I would say three set. The third one is a rare one. One is those who are not into gym, not into diets, not into supplements, nothing. They develop it either because of weight gain, their BMI is on a higher side, or they developed it when they were around 14-15 years of age, when a physiological form of gynecomastia, that is pubertal gynecomastia, usually develops, and it usually disappears on its own in next 1 or 2 years. If it has not disappeared during that time frame, then it is recommended to get it removed, because it won't go away on its own. So that is why I recommend my patients to get it operated who develop pubertal gynecomastia, who developed it at the age of 13-14, to get it operated after the age of 17. So you get a fair amount of time in which, if it has to disappear on its own, it will disappear on its own. The second set of patients that I get is those who are into supplements. They have taken injections while building their muscles. They have taken steroids, testosterone injections, androgens or anabolic steroids, and they come by various names, and I do not recommend them to any of my patients. And because of those supplements, they develop a gland, and this is seen mostly in those who are bodybuilders, into fitness, and they develop a gland, and they have a very less amount of fat, because they usually have a body fat percentage of somewhere around 5 to 15%. They're extremely fit, extremely muscular, but they've developed a hard gland, and those patients will definitely remove gland removal. They will need gland removal. The third set of patients which I get is those who have congenital deficiency of testosterone hormone, that is the male hormone. They don't have those male hormones. So how can you identify which category do you fall into? So if you have taken any supplements, you know it. If you are from the first category, you have overweight, you know it. The third category, if you don't develop the secondary sexual characters like beard, like a normal male, don't develop the chest hairs, like if you don't have that male pattern of body shape, if you don't develop normal growth of your penis, your testes are not palpable, the body hair in the pubic area are not good, in those cases there is a probability that you might have a deficiency of testosterone. In those cases, we will get your hormone profile done, and then we will go through it. Even after you get your hormone profile corrected there are medicines in which you can take testosterone and get your hormones normalized. Still, if you have developed gynecomastia and if it has persisted for more than a year, you need to get it removed. The other set which I recently are more into my practice are those who have lost a lot of weight after bariatric surgery. A lot of hanging skin, loose skins, and they are not exactly gynecomastias. They are actually the effects of body weight loss, which have loose hanging skin, and that is totally out of spectrum, so I won't be covering that in today's talk. Will it come back after surgery? No, it won't, because I have already removed it. What are the treatment options? So treatment options, medical management is possible only for those who have recently developed it and less than a year. They can opt for a medical management. For that, you can consult me. Most of the patients that come to me do have it for more than a year or so. They have tried almost everything. They have tried homeopathy, they have tried Ayurvedic, they have tried drugs, they have tried hormones, they have tried almost everything which is available on internet, and it doesn't really work. See, if there is a medical management, nobody will opt for a surgery, and this is a very common surgery which happens in our practice and in various other centers in Delhi and all over the world. So something which can be tackled with medicines, there won't be a surgery for it. So you need to understand that it is to be operated. It is a breast that has developed into you, and there is no medicine that can remove a breast from a female. So that is the same way that has happened to you. The treatment option is surgical. And surgicals, we have two major things. One is liposuction. Liposuction will remove the fat that is deposited on your chest. Liposuction will get rid of it. The second is gland removal. Gland removal will remove the gland. So depending on if you have a gland, if you have fat, or if you have both, we have to mix and match the treatment, and usually we combine both. Everybody has some amount of fat. It is only for those who are in the body fat percentage of say 5% to 10%, they don't have fat. Most of the patients have fat. So first we do a liposuction, and then we do the gland removal, and that is how you get it treated. So what is the best treatment for me? The treatment for you depends on what grade it is, how muscular you are, if you have a gland, if you have fat. So if you have a combination of both, the best treatment would be to have a liposuction and then a gland removal. If after liposuction we feel that there is no gland, we do not do the gland removal. If there is a gland after liposuction, it's a hard gland, we have to give a semicircular cut which is almost invisible after a month. We remove the gland and you're good to go. What is the best time for surgery? So those who are teenagers, I recommend them to wait till the age of 17 to 18 if they don't have too much of psychological issues because of huge breasts. That has happened to few of the patients, and I had to operate them at a very tender age of 14, 15 also. But most of my patients, they wait till the age of 18 years when they are ready to give consent on their own. And after that, there is no hard and fast rule. You can get operated anytime you want. I recommend my patients to stop smoking if they smoke for at least 6 weeks, if not 6 weeks, for at least 2 weeks before the surgery, because that promotes healing a lot. If you are taking any kind of supplements, say multivitamins, vitamin E, fish oil, omega-3 fatty acid, Ayurvedic drugs, homeopathic drugs, or any other sort of supplements, I recommend you to stop them for at least 2 weeks before you get operated, because these supplements, protein shakes and everything, might have something in it which causes blood thinning, and that might cause a bit more bleeding in your case during the surgery. I would recommend you stop them before the surgery. What is the recovery time per se? So once you get operated, say you get operated on a Friday, if it was under local anesthesia that only your chest was numb, you get home, you can go home after half an hour, 1 hour of rest, and then I call you back after 2 days. After 2 days I remove all the dressings, and there's only a pressure garment that you have to wear. After 2 days you can go back to your work, your college, you can start your normal life. What is not allowed is any sort of exercise. Cardio is allowed after 15 days, and your proper gym, that is push-ups, pull-ups, your pec deck and all the chest exercises, heavy weight lifting, after a month. And you have to wear pressure garment, which I do provide, one set, that is 2 pressure garments, 24/7 for a month, and that is compulsory. If you do not want to do that, I will not operate you. So I've already answered when you can go back to work. You can go back to work after 2 days if it's a sedentary work, and if it's a light physical activity. If it's a too heavy work, then you have to wait, and your life starts on the same day as on the day of surgery under local anesthesia. You can walk back home after an hour, and in GA you can walk back home after 6 hours. Smoking and drinking. Smoking should be stopped ideally 6 weeks before the surgery. It helps promote healing. If you are to be operated under general anesthesia, if you stop smoking, your recovery is much faster. Chances of complications are much lower. I try to operate my patients who smoke under local anesthesia. It's much more safer for them. Skin excess. 90% of the patients do not require any sort of skin removal. I am not a fan of removing the skin on the first sitting, and out of the most patients I've operated, there are hardly 2 or 3 patients who required skin removal after 6 months of the surgery. Like I've already explained, in a pregnant female, once the baby is out, the skin contracts back, but nobody can guarantee you that it will contract back completely, but most of the patients are much happier. And see, the issue is removal of the skin will give you a big scar. So we'll discuss it with you. What are the options of removal of skin? If you are okay with a bigger scar which is visible even after it heals, then we can opt for skin removal in the first sitting. But I usually give them an option of not getting it removed in the first sitting, because most of the skin, it does contract, and there's hardly any skin that remains. So until you are not grade 4 or very, like your breasts are hanging till your tummy, I do not opt for removal of skin. Results, you see the results on table. If you're under local anesthesia, I'll tell you to get up and see your chest so that you can appreciate it on table. If you were under general anesthesia, usually by the time you get up, there is a dressing, so you see your own pictures, or else when the day we remove your dressings, that is after 48 hours, you can see how you look, and the results are visible. They are drastic. You can see it on table, and they keep improving for up to 3 months to 6 months, but you can see the patient's result on table. Scars. So the scars that you will have is a very fine scar just in the axilla, which is invisible. Other scar in the axilla, so both these scars are almost invisible. The other scar these are for liposuction, and the other scar that I give for gland removal is on the junction of the areola. So it is at the brown portion and the normal skin portion. So the scar is almost invisible over there as well, and it usually heals in 10 days, and that is when I again call you after 10 days to see for the scars and everything, and I advise you for your rest of your month and so, and then I see you after 3 months. Post-op care is usually that you have to wear the garment for 1 month and you have to apply an ointment on the scars for them to not get infected and for them to fade away as soon as possible, and you have to take antibiotics, painkillers for a week, and that's it. Surgery, I'll make a separate video on how I operate, and you can go through other small videos I've already made. Local anesthesia, general anesthesia, which is better, what will suit you more, what are the steps of the surgery. It's a completely big topic and I'll do them separately. Complications that you can have, see, you can have infection for which you have to take antibiotics. Once you take antibiotics, these days the antibiotics are so good, you don't really get infected. So it's a very rare phenomenon now. The second is bleeding that might occur. So for that I ask you to stop your supplements. We take your blood samples before the surgery to check for any bleeding disorders. If you have that, we act accordingly. And in case in the surgery I feel that there is some sort of bleeding, I'll put a small catheter inside, which will come out through the liposuction port only, and which we can remove 1 day after the surgery with no additional scars or anything. It's a very rarest of rare phenomenon in which even after there was no surgery, no bleeding during the surgery, you might have some sort of bleeding in the post-op period. In that case, we might have to remove the blood, but it's never life-threatening. There are no major structures involved, so it's never a life-threatening bleed. And I always call my patients 48 hours after the surgery just to check for that. The scars may be a problem for few, so those who have a keloidal tendency or a hypertrophied scar tendency, you have to inform your doctor, because then in that case we take special precautions so that you have even lighter scars. Local anesthesia, general anesthesia, I'll try to explain it with the surgery. For those who have a smaller gland, grade 1, 2A, I prefer local anesthesia. But if you have a fear of injections, blood, you don't want to see, you have to have a surgery which is absolutely pain-free, you do not want to see anything, then you have to opt for general anesthesia, and we have the option of both of them. The cost you can discuss us, but I can assure you will get a very good price, that's all. We have options of high definition chest creation, in which we give a shape to your chest so that your pecs or your pectoral muscles look much fuller. We remove all the fats on the sides, on the below portion, so as to give you a good cut. You can ask for that if you are interested in high definition liposculpture, and if you want to get your six-pack abs, and if you want a liposuction of your tummy along with the chest liposuction. And the stay, local anesthesia, you can walk back home after 1 hour. If you are not feeling comfortable, you want to stay back with us, you can stay back with us for a day or two. Under general anesthesia, I would recommend you to stay back for at least 6 to 7 hours. If you are from far away, not from Delhi, I recommend you stay back here for at least a day, so that overnight you stay and the next day morning we can check again and then we can let you go. Okay. And then there is a question that patients ask me, can I come alone? Do I need to bring someone? So I always advise them to bring somebody alone. It's a surgery. It's not a beauty parlor sort of a thing or a cosmetic spa sort of a thing. It is a surgery. And you should always have somebody with you for your support. Can be a friend, girlfriend, boyfriend, your parents, your family members, anybody whatsoever. Bring somebody along. It's just not so big issue. We have our staff which will take full care of you if you opt to have a gynecomastia surgery with us. If you have any further questions, you can always WhatsApp us at 9599554211 or 8448884776. Thank you and have a good day. If you have more questions, you can ask me, and I'll keep on making future videos so that you get to know about gynecomastia in much more detail. Thank you and have a great day.